This is huge. A knee replacement surgery can cost anywhere from $15,000 to $70,000, right? And this is ridiculous how this costs. And that's why there's a big push for cost transparency. Not only are costs exploding, but we're also seeing denials increase. This brings me to that unfortunate case that happened in December with Luigi Mangione took out the CEO of United Healthcare in New York City. It was like something that shocked the world because this person was a young person that took this CEO out because denials, issues with insurance, and it struck a nerve in America because why is healthcare insurance such a big deal? As a medical practice owner, it's important to understand the world of what's happening with healthcare insurance, right? This is a program that's affecting nearly 18% of our US GDP, our gross domestic product. Today, we're going to dive into the intricate world of healthcare insurance, right? And let you understand a little bit more about this system that affects over 330 million Americans, according to the CMS. The average American spends on average around $12,914 on healthcare. This is huge, and this is something that we're going to see more and more of as healthcare costs continue to balloon. If you're thinking about this as an American, you're spending almost $13,000. That's $1,000 a month in healthcare. And this is for those who don't have exorbitant amount of healthcare costs, right? This is middle class individuals, younger to middle age individuals. They are the ones who are seeing their healthcare costs explode. Obviously, older Americans, that is something as you get older, you're going to have more and more healthcare costs. But it's unfortunate that we're seeing these costs explode up so much. So let's talk a little bit about the healthcare basic infrastructure and what we can do about it. First, the healthcare insurance system is basically a risk pooling model that manages approximately 4.3 trillion in annual healthcare spending. So risk pooling, what does that mean? Basically, it's a system that looks at individuals and determine like how much it's going to cost to take care of a patient for the year. By some estimates, they're looking at paying roughly insurances are looking at it's going to cost about $10,000 a year in order to keep you healthy, right? And that's how they budget it. If you go above that, then they create what they call a risk factor that's targeted toward that patient. And if that patient population has a higher risk factor, in other words, the cost that will be to deliver care for that patient goes up above that 10,000 mark, then you get a higher risk factor, right? And that could accommodate a lot of other things. It affects reimbursements, it affects the care that's needed, it affects how providers look at you in a pool of resources. That is something that you have to realize that is really based on what they actually project spending on healthcare will be. And based on that, they determine, what your healthcare costs could be, right? So if you're a younger male, 25 years old, your healthcare costs will be lower than your 85-year-old grandmother, right, who has multiple comorbidities like high blood pressure and diabetes. It makes common sense, right? Well, the challenge with that is that because health insurances, they do so much, they have to process over 1.4 billion claims every year, according to the American Health Insurance Policy Group. And they say this is a huge amount. And one of the things is healthcare providers make up the majority of folks that bill to insurers, right? And so there's roughly about 6,000 hospitals nationwide looking to provide healthcare for patients across the US. When you look at that, employee-based healthcare is the biggest way that most Americans get their healthcare. Roughly about 156 million Americans get their healthcare from employee-based plans. That is why a lot of people, when we look at unemployment rates, you want to make sure they don't go too high because unfortunately in America, if you don't have a job, healthcare costs can get even more expensive. Typically, if you have an employer-based healthcare plan, they will pay what's called a percentage of premiums. Just like any insurance plan, this is something you pay into a pool every month that allows you to kind of get access to insurance when you need it, right? And so when you have insurance that's based by your employer, typically they will pay a percentage of those premiums to help cover that cost. But if you don't have an employer, then that's when costs can balloon up even more so for you. Again, that's why we're probably seeing some of the costs go up because we are seeing cases where these insurances are increasing more and more for folks who don't have a traditional W-2, right? And so that can be an issue. If you're a 1099 employee or your contract employee, then obviously your healthcare costs can go higher because you don't have that employer helping subsidize your premium costs for insurers. And that can be a problem. I can think for myself as a entrepreneur who started our own business, that was a big risk factor. I had a W-2, worked for a corporation for 20 years, understood the premiums. The corporation paid 75% of that. So basically, that was low cost for me. And then typically, what's happening now, there's a shift into what we call high deductible plans. So basically, before your insurance even kicks in to pay for any of your healthcare costs, you have to meet higher amounts of money you got to pay before that kicks in. And now these high deductible plans are becoming more popular because obviously the premiums are lower. You don't have to pay much month to month. But what's happening is those high deductible plans are becoming more and more structured so that it's harder and harder to meet that deductible, right? And so this is important as a medical provider to understand what your patients are going through, right? I think as a healthcare provider and a medical practice owner, you understand those concerns. You understand those concerns from your patients because those are the things that you're hearing about when they complain about paying copays, which is that part that they have to pay after the 80% is covered by the insurance, right? Or understanding why the drug costs are going up. You may have to kind of deal with those questions, even though that's an insurer question, right? Because insurers help pay for drugs, they should help pay for the care and the ancillary services that go along with it. So as a healthcare provider, it's really important to understand what your patients are struggling with. Likewise, like I was mentioned before, when I was part of an employer system, they paid for a lot of that. But then when I was no longer a part of the employee system, then as an entrepreneur, a lot of those costs came back on me and those premiums were higher and I had to pay 100% of those premiums. And that effectively decreased my potential discretionary income because think about it, I'm paying more into healthcare costs, right? And if you have a family of four, those can balloon up pretty drastically. So when you kind of look at that, one of the other big payers, we talked about employee base, the other big payer is Medicare and Medicaid services. They service about 140 million people. And typically those Medicare are 65 and above. Medicaid are patients or individuals who just don't have the funding to kind of get traditional employee-based care. They do state-funded Medicaid, which obviously those costs and those premiums try to be a little bit lower to accommodate people who are maybe middle class and a little bit lower in that status. So when you kind of look at that, it's really can be complicated to kind of navigate the system. And like I mentioned before, family of four, when you look at an average family premiums reaching roughly about 22,400, according to the Employee Health Benefits Survey in 2022. And this is something that we're seeing more and more, the rising premium. So think about this. They're estimating that it's only going to take them $10,000 per person to pay for their care. And you're paying out premiums of 22,000 to kind of just cover in case things happen with your healthcare. That doesn't include what you're paying out for deductibles, right? Typically, those deductibles are like $7,500, $5,000 that you're paying out. So you're estimating roughly out-of-pocket costs between premiums and deductibles and ancillary copays, roughly $40,000 to $50,000 that you're paying out every year for average family. So this is huge. I mean, this is why you're seeing healthcare just explode. And the other issue with this is just the complexity of it, right? There's no transparent pricing. We don't know exactly what people are being charged. They say the charge master rates, these are just negotiated rates that the healthcare providers, do with insurers. They can vary. There's a lot of variance. Basically, the cost can be different and it can be different based on geography, it can be different based on who you're delivering the service to. So you're looking at up to thousands% between facilities of cost variance, right? And that's according to the Healthcare Cost Institute from 2023. And so when you kind of look at that, typically providers, that's why they try to get together. That's why you as a Medicare provider tries to group together with other organizations, right? Like accountable care organizations or become part of multi-specialty groups or get bought out by hospitals because if you're bigger, then you have what's called purchasing power because you can negotiate rates a little bit lower than a standard by himself provider. Typically, when you negotiate those rates, you can get them down 46%. what the charge master prices are, which just helps. So this is something that's really important to understand why a lot of independent practice owners like yourself are struggling because you just don't have the purchasing power to kind of negotiate rates at a fair exchange. But there's some things that we'll talk about later that will get into why this is important. When you kind of look at the varying costs, right? For instance, MRI, which is our standard way of looking inside the human body, that can vary in cost anywhere from $375 to $3,500, even in the same city, right? The MRI is expensive. And typically that can be something that can really understand what's happening with the patient when you kind of understand that data that comes in from a testing standpoint. Getting a basic metabolic panel can cost anywhere from $35 to $400. This is huge. A knee replacement surgery can cost anywhere from $15,000 to $70,000, right? And this is ridiculous how this costs. And that's why there's a big push for cost transparency, right, in America. But one of the things that we saw was not only are costs exploding, but we're also seeing denials increase, right? They're saying 18% of in-network. So basically, these are providers that have a contract with an insurer like United Healthcare. Just 18%, almost 20% of them face initial denials for any type of care or service. This is huge. So this brings me to that unfortunate case that happened in December with Luigi Mangione, the misguided gentleman that unfortunately took out the CEO of United Healthcare in New York City. The case was sensationalized, right? Because this individual did it boldly in broad daylight almost. And it was like something that shocked the world because this person was a young person that took this CEO out because denials, issues with insurance. And it struck a nerve in America because how many Reddit posts, how many individuals saw that these things came in and they saw what they could do to kind of mitigate these issues. And a lot of people were just struggling. They told their story. And I have a story like that too. I had to do an MRI, right? And initially I thought I was going to be denied. One of the biggest companies that does this is Evercore, and it's a healthcare insurance that specializes in medical benefits management. It provides services to health plans and other healthcare organizations to help them improve the quality and affordability of costs. That's what they say on their website. But basically, their goal is to kind of understand exactly how to manage who's going to get the service they need and who's not, based on a variety of factors, right? So they do things like prioritization, the reviewing if this patient can qualify for this MRI. For instance, I got a letter literally from Evercore to say I finally qualify, but that was after the doctor had to do other things first, other tests, other things before I could finally get MRI and find out I had an issue with my knee, a meniscus tear. And so reviewing medical records and determining if a requested treatment is necessary is something that they do consistently. They do utilization management where they identify and prevent unnecessary, inappropriate healthcare services. So again, they're looking at where can they cut costs and is it care for this patient necessary? So think about that. You're going back and forth trying to figure out if you can get help you need. Your symptoms are getting worse and worse and you just want a cure and you would pay anything to do so. And so that is what's a lot of people were resonating with when Luigi did what he did because they felt that need of getting healthcare and being denied, and especially when healthcare costs are going up. There's just a disconnect, right, between what people are paying out and what they're getting for, right? We're used to, you pay what you get for, right? But in our healthcare system here in America, doesn't seem like we're getting that. And I think that's what's struggling with a lot of people, that disconnect, right? And understanding that. Also, they do case management. So basically coordinate care for complex patients. So if they can kind of coordinate care, which I think is good clinical practice, right? So if a patient is discharged from a hospital, transitions of care to make sure that they understand what that patient needs. So if they need to move to a skilled nursing facility, right? Or to a home health agency, understanding what's needed there so that there's continuum of care. And then data analytics, which is really diving into data to determine, what things are needed to kind of make sure the patient gets what they need. The thing about healthcare insurance, right, they use a lot of what they call actuaries, these individuals that calculate numbers to understand predictability, right? They can predict, in essence, based on what you eat and how old you are and where you live, how long you're going to live, right? And so they use these huge statistical models to determine all this. And once they kind of figure that out, then they kind of use data to kind of determine how best to care for them. And there's a lot of evidence-based studies that show like things that can help with preventative care, right? Things like, remote patient monitoring, basically monitoring patients at home with blood pressure cuffs or glucose monitors, right? Patients are more involved in their care, preventive care services by making sure they get the access they need when they need it, making it more accessible. So those are things that we know can work. But again, that cost factor is always going to mitigate that. And that's why we're seeing that disconnect with your patients and the care that you provide to them. Another thing too, surprise billing effects. Like there's been 1 in 6 emergency room visits, have bills that you didn't see coming. For instance, when my wife was pregnant with our second child, I looked at the cost and said, this is everything we have to pay for. And this is, and mind you, at the time I was with an employer. So basically they were paying a large percentage of that. And I had some copays. But after the fact, come to find out, there's all the other bills. So not only was it the facility fee that I had to pay, right? But the provider who actually did the service, delivering my baby, the gynecologist, the doctor, but also had to pay for anesthesiologists, right? And then I had to pay for a specialist that came in for other issues, right? That came up from complexity of my son's case. So it's like all these other bills just popped up when you thought you had budgeted properly, especially for an emergency room or like a big type of procedure. And that's the thing that really shocks people a lot of time. That's that sticker shock process, right? Think about claims. There's so many different claims. Last year in spring, March of this time, there was a huge healthcare hack with Change Healthcare. If you don't know Change Healthcare, a company that kind of helped manage the process of claims. So there's a standard way you submit claims in order to get compensated. This organization was handling that for 80% of providers out there. There's a hack. Hackers got in there and they said, we have this data, pay us this amount of money or we're going to release that out into the world. And once that got released out, there was a lot of what we call PMI, patient medical information that got out there, something that was not allowed. And that's something that should never got out there. It was a huge cyber attack and that shut down a huge processor of claims in order for people to get paid. So I had cases where doctors themselves were struggling to make ends meet with reimbursements because they weren't getting paid for 2-3 months before this healthcare, because majority of their claims were going out through Change Healthcare and they literally stopped processing claims as they were getting it through. So when you think about this was huge. There's 68,000 ICD-10 diagnostics codes. These are codes that specifically say how much a doctor should get paid for a procedure, right? There's 87,000 CPT procedure codes, right? The average processing time should take between 14 and 30 days. And sometimes when those claims come back, even after the fact of prior authorization to make sure the patient is qualified to do this, you still get denials. So 11% of all claims are denied, right? And there's a huge cost to that. It looks on some estimates, there's like 15 cents to 27 cents per every dollar of claim is spent on just processing these claims, verifying denials, and understanding, why they got denied in the first place, right? And then submitting medical records to ensure that you can repeal that denial. So there is a lot that goes into like just processing claims. And so understanding that part of the system is huge. Current challenges, right? We talked about it, right? The rising costs. We talked about why it's important that patients have employee-based healthcare as opposed to going their own, understanding the variability in cost depending on what city you live in, the understanding of the risk-based model system of who you are and how you get your services, right? So this is also paired against the other trend of cost increasing overall, 5.6% annually, right? With general inflation. Obviously, we saw a huge influx of inflation after COVID, and there's talks of even more inflation coming with the rise in tariffs that will rise the cost of any goods that we get from overseas and then vice versa. So our everyday items that we purchase, probably they would pass that cost on absolutely to consumers. And so I think the inflation costs are just going to continue to rise, right? And so we're going to see that increase. And then even though the Affordable Care Act came and did things to kind of increase the pie of people be a part of healthcare, we still see 28.9 million, almost 30 million Americans that are uninsured. And so imagine if there's a health issue, they get treated ED and they can't pay. What happens? That cost gets ate up by the taxpayer ultimately, right? And yes, they're financial ruin where they may have to file for bankruptcy to pay for that cost, but someone has to pay for that services, right? And it's typically the taxpayer. So this is something that we're going to see more and more over time. So look, let's end this on a positive note. What things can we do to kind of help health insurers, right? And what are you doing as a healthcare provider to kind of manage this and think through this process more clearly? Number one, value-based care is here. This is basically understanding how you can get incentives for taking care of patients more effectively, right? And so instead of doing fee-for-service, see a patient basically get paid for whatever you do, no matter what it is. This is just bringing more thought process into how you care for patients, right? Looking at the continuum of care. So for instance, you have an older patient and if they have hypertension, Give them a blood pressure cuff to take home. We know there's clinical based studies that you can get them into type 2 below their hypertensive rates, which is 140 over 90, get that below by just simply monitoring them daily because they're seeing the data and they're understanding how they need to change, not just for diabetes, but for hypertension, for high blood pressure. You can do this for diabetes, understanding patients that have high glycemia and understanding what you can do to kind of manage that process more effectively, right? To ensure that they stay out of hospital. Value-based care is all about managing care and giving patients, preventative efforts like chronic care management, for instance, has been around almost 10 years. Calling patients who have two or more chronic conditions and managing that process, that they eat well, are they exercising, are doing little things to stay healthy, giving incentives for that to the patient, but also as a provider, because if you do that, then you get incentives. And that's what it is. Value-based contracting and value-based care is all about making sure that you as a provider get the best care to your patients, but also you will get incentivized for that because you're doing more and you're doing what's best for the patient ultimately. Digital health can absolutely reduce costs of administrative tasks that deal with managing healthcare. According to a McKinsey study in 2023, this can be huge. One of the things that we're seeing is like making sure you manage the process, outsourcing, allow those hard to do tasks when it comes to, if you're going to get to remote care services like remote patient monitoring, chronic care management, principal care management, right? And even new services, you want to make sure you can cover that cost at a high level, right? And be able to kind of deliver that. And how do you deliver that? You want to get that administrative cost as low as possible. And you can do that by outsourcing a lot of these resources and making sure you have the team that can do so and partner with the right organizations like SensorMed and other organizations that do remote patient monitoring to kind of deliver the care that you and your practice needs. So ultimately, healthcare is at a crisis right now. This is something that we're seeing more and more with rising costs, change understanding of costs. We're seeing the lack of transparency and getting care to patients when they need it. More and more things are happening. The rising costs of inflation, all these factors are bubbling up into more and more frustration by the general populace. And so you as a healthcare provider should be aware of all these different factors and have empathy when you have conversations with your patients to make sure you give them a spiel of what you understand and how you can help them through this journey. And I think that's where it starts, right? Just being upfront and honest and having a transparent conversation with the patients about the realities of healthcare now. And as you as a provider, the more you understand this, the better provider, better clinician, better doctor, nurse that you can be, because now you can have a more general conversation and understand where the patient is coming from in that 15, 30, or even hour session you have with them going over their general plan. So if you like this content, definitely let us know. Let us know what your thoughts are about health insurance. Obviously, it's a hot topic right now, but I would love to hear. Comment below. Check out more content on what we talk about remote patient monitoring below.